Well, doctors this winter describe a race between COVID-19 vaccinations and variant strains of this virus.
The Utah Department of Health tracking 3 main variants, and this week they started posting that data online. News specialist Jed Bowe reports doctors are optimistic that the vaccines will work against those variants.
One of the 3 main variants, the UK variant, has been identified in Utah. Most of those cases here in Salt Lake County. So there's a real urgency to get more people vaccinated before those variants can take hold. But doctors are optimistic that the vaccines will work against the variants.
It's a race to get as many people vaccinated and get as many people immune to this virus.
While COVID case counts decline, doctors worry about variants and what level of protection vaccines provide.
This is why we don't just say, hey, we're done, we're finished, and celebrate. We have to get as many people vaccinated as we can so that we can really keep the transmission of the virus down.
The Utah Department of Health COVID dashboard now posts COVID variant surveillance, showing more than 70 cases of the B.1.1.7 variant first identified in the UK, but less than 1% of all Utah cases. State epidemiologist Dr. Angela Dunn says that variant is known to be more contagious and more severe in young people.
However, we have really good news. The vaccines work against the variants. And we're doing a great job in Utah at getting the vaccine out to our population. So it's so important that when the vaccine is available to you, you get it.
Pfizer has announced that it looks like right now, when they've done testing in vitro in the lab, that their serum for their vaccine actually is effective at neutralizing the variant strains.
But less effective against the South African strain. Each of the vaccine manufacturers working on this issue and considering their options, including boosters. The CDC says studies suggest that antibodies gathered through vaccination do protect against variants. Meantime, masks and physical distancing still protect against the virus.
So let's keep using those tools until we all get vaccinated.
Ventos says those mutations were expected, so it would not be unusual for the vaccine manufacturers to alter their serum or come up with booster shots that we might take annually. For KSL 5 News, I'm Jed Bowe.
Jed, thank you. A new study